Hello, you guys. I just wanted to take a little bit of time to talk about the removal process for the spinal cord stimulator. I'll also give you an opportunity to look at the kit that I was sent home. When I say kit, I mean the charger, the iPod that accompanied the device, and I'll explain some of those things. I tried to find editing software that I could place the video on screen so that you could take a closer look at the pictures while I'd explain. But I could not find any editing software. So uh, I apologize. If you know about any editing software that you can let me know about, that'd be great. I'll definitely look into it. So I've got the images pulled up on my laptop. The reason that you see a black screen right now is because I do want to give more sensitive individuals the opportunity to back out of this video. You never know what triggers different people or what images are upsetting for some people. I do want to say that to me, the images are pretty PG, and I feel like there's nothing graphic about the images. There's no blood. There's really nothing to see that I think that would be upsetting to someone. So the only thing you're gonna see maybe is an obese woman showing you a couple of bandages, and that's about as graphic as it gets. So that being said, if you feel like you don't want to look at what the area is going to look like, I would say back out of the video. And I'm sorry that I couldn't accommodate you any further than that. But for those that are not sensitive to something like this, we'll go ahead and press on. So the first image I'm going to show you is from my wound check. I only have two images from the wound check. They wanted to make sure that this happened 3 days after the procedure. They just wanted to make sure I wasn't showing any signs of infection. So everything was untaped so they could take a look. And we're going to look at that image now. And my tablet may auto adjust, so it may blink in and out. So that's what it's doing. It's just auto adjusting. But as you can see, it's not really graphic. I mean, the white patch that you see here, that's actually the device. They taped it to my back. And so with this right here, that is actually where the leads entered my back. So you got the device taped and the area to just secure those leads down. All right. So like I said, it's not really graphic. There was nothing going on. I had a really good wound check. I didn't have any drainage. Everything was very clear and clean, and I didn't have any problems. So let me go to the next image. Give me a second here. We'll get to the next image on here so you can take a better look at the actual wound. So looking at the actual wound, you can see it's a little tiny hole. It's very, very tiny. This right here, you can see the first lead, and the second lead is just right above it. So I had both of those leads going there, and it's just a little tiniest hole, and it's not uncomfortable at all. When they did the wound check, when she removed the tape, you know how it feels when they take medical tape off. That's about as difficult as that got. Taking medical tape off is definitely not a challenge. But when it was exposed to air, it did sting a little. Just like you kind of cut your hand a little bit. It was just a little bit of sting because the air was hitting it. Nothing traumatic at all. So nothing really going on. That's as bad as the wound looked. So expect to have a wound check after you get finished. After you have a few days in. Like I said, it was 3 days in that I got a wound check. Just a really quick office visit. They're going to ask you questions. Make sure that you're not having any particular effects. Like I said, it was really, really easy process. I wanted to let you take a look at the unit itself, or what I was sent home with. I know in my previous videos, I have not mentioned what device I had. So as you can see here, the device that I was using was from St. Jude Medical. If I'm not mistaken, there are two other companies out there that are well known for their stimulator trials. With my device, you don't feel the therapy. So if you're like me, you start looking on YouTube trying to find people that's been through this before you make the jump yourself. And so I end up looking at a lot of old school videos, and they will tell you, oh, you can feel it tingling, and it's kind of weird. No, when I had my device, I felt nothing. There was no tingling. There's nothing. You know, I felt nothing, which is great. I felt nothing but relief. Let's put it that way. I felt the relief of the device. Um, if you haven't seen the other videos, I'm very pleased with my spinal cord stimulator trial. And my God, I can't wait until I get it permanently. You have no idea how ready I am to crawl on the operating table. I would put the scalpel in the man's hand if I could. But all things come with patience, I guess. But the trial was the best thing for me. And I hope that if you're going to do it, I hope it works well for you. But if it doesn't, hey, look into other options. This isn't the end of the road. But just to give you my experience, it was great. So when you open up the kit, let's go to the next picture here. Oh, if I can get to the next picture. Hold on a second. Oh, wait just a second. Let me change this. I want you to be able to see. I'm not the best picture taker. And now my program closed on me. I gotta get some editing software, you guys. I hate for you to watch me poke around on the keyboard. Hold on here. Let's try to pull it back up. Come on, computer. Okay, let's go back. I look like I went a few steps ahead. So when you look at the device, oh, come on, autofocus. You've been autofocusing all day, and now it doesn't want to autofocus. The kit basically came with an iPod. So there we go. Better shot. So with the little kit, you get the iPod, which I use to control the device, your charging block, your charging cord, and then there's a magnet. Please don't ask me what the magnet is for. I swear the representative told me what it was for. But when you're kind of under anesthesia and just ready to go home, you really don't pay a lot of attention to stuff. So it really helps if you have someone in their right mind while you're post-op. You might want to have someone listen in on the instructions that you're given. But I was in there by myself. So there's a magnet. I have no idea what it does, but hey, charging block, definitely know what that does. iPod, it has the app for the device and the charging cord. So FYI, for the device that I had, you actually have an option of not carrying around a remote control. Once again, going back to some of the old school videos that you'll look on YouTube, they're talking about having a remote. Well, you know what? You don't have to actually have a remote control that looks like it goes to a TV. You can actually place an app on your phone or on your device, such as a tablet, just as long as it's a smart device. You can actually use an app. And I'm going to show you what that looks like. But yeah, you can use an app to control your device. So if you got an iPhone or you got an Android, you're going to be good to go. You can put it on that. So this is just me turning on the iPod, just showing the time and the date, and nothing to see there really. So here's the app that I'm talking about. If you see right there, that's it. It says patient control. And it has the SJM to let you know that that's the device for that spinal cord stimulator. So, of course, you would open that device like you would anything else. And then as soon as you touch the button to open that device, I would hope that it has a better shot. It's going to have your name and the security number, or well, the serial number there in that bar, and you would touch that portion of the screen to bring up the the device control functions. So as soon as you touch that bar that I told you earlier, it's going to give you this screen. I can't believe this thing is not auto adjusting. I'm sorry about this. Normally it auto adjusts. As you can see, the first bar up there tells you program, and if you can faintly look out on the other side, it really says program 1. These devices can be programmed with a number of programs, if I'm not mistaken. I want to say that he was telling me that eventually you could have like about 10 or more. I just really don't remember the number, but it's a number, several different programs can be placed in there for different treatments. And when the device is on, that bar is going to reflect green. In order for me to cut it off, I would just touch that green bar and it would just say therapy off, and it would turn red at that point. At the time when I shot this, I was on a strength of 7, and I could touch that to turn it up or down. And also, when you're looking at this, it's showing you the treatment area. I'm trying to get it to adjust a little bit, but I'm sorry, I can't. It's so bright that you can't make out, but this is actually a figure of a man that's outlined. And so the blue area reflects what's actually being treated. And that's my left leg. So I didn't have any programs for the back region, because for me, all of my significant pain is literally my leg. So that is that. Wait, I think I got a better shot. There we go. It kind of looks better. Yeah, that's what that screen looks like. For the most of my trial, I was on the strength of 7. I only had to go up to 8 on one day that it kind of got rainy. It was a little rough on me, so I had to turn up the intensity. But I did really enjoy my stimulated trial. So once that the trial was removed, this is pretty much what my back looked like. And all of that's just tape residue. Like I said, you're gonna be peeling off medical tape for a little bit, trying to get all that stuff off of your back. Is so icky. I had so much residue on my back that my shirt was literally sticking when I got out of that office. So what I want to tell you about is the removal process. Guys, don't worry about the removal. It is literally it's nothing to even think about. I was worried that it would be painful. Zero pain on removal. You can go to the office yourself. You don't need a ride. You know how most of the time you're in a situation where you need someone to drive you and you're not allowed to drive back. Not in this. In order to remove it, you can take yourself to the office and you can take yourself back home. The only thing that I would tell you about removing the leads, if I just had to advise you on anything, you guys, that feels weird. Oh, it's the creepiest, weirdest feeling I've ever had. That's it. It's just weird. And it's so weird because there's nothing, I just can't think of anything to describe what it feels like, because I don't know when you're in a situation where you can feel something literally sliding out of you, because that's what's happening. That lead was way farther up my back than I thought. And for me, I just assumed that from where it entered, I thought that the lead was like somewhere in the mid back area. Now, my ignorance, I just thought it was there, but no, it was literally at the very top of my spine. Now, you can see this dark area here. I don't want you guys to worry about your back looking like that, because what you're actually looking at, I wish that I could get a clearer shot, but that's actually stitches. I had 8 stitches in my back because during the process I had a bleeder, so they just hit a little opening there, and they couldn't stop the bleeding, so they had to just sew it up until they stopped it. So that's actually a lot of stitches that you're looking at. So in my removal, like I said, it's just weird. I wish I could describe it to you, but I want you to know fully that it does not hurt. My nurse was like, oh, and the nurse removed it. There was no doctor involved in this. It was just the nurse practitioner. So I laid on my stomach on the table, and she took off the tape, removed everything, and she told me to count to three. And I was like, okay, one, two, and on three, literally, you feel this creepy sliding down your back all the way out. And it's like, oh my God, ugh. It's more of a ugh feeling. There's no pain. It's like, ugh, that's weird. Ugh, that's so nasty. Never had anything like that, but no pain. So I just want to reassure you that. Now, the only reason that I had pain in my system, if there's going to be pain involved, it was taking out those stitches because they had scabbed over. And if you don't know anything about stitch removal, and when your sore scabs over the stitches, they have to pick at the scab in order to find the stitches, in order to cut them and to pull them out. So it was like, oh, that stings. No more than I would relate it to, no more damage than you messing with acne on your face. Like if you're pimple popping, it's like, wasn't that bad getting the stitches removed. But that lead removal was absolutely nothing to worry about. So that's the leads that were removed. One on each side. So I had two leads. And to give you an idea, like, my tablet is, I think I've got an 8-inch tablet, and I had when I laid that out straight and laid my tablet against it, I at least had a few more inches on it. Those lines are long enough to literally go from the top of your spine all the way to the base. So they're in there. They're in there pretty deep, but no worries. As far as the pain afterwards, I would say that I was just a little sore, just a little bit. You know that something was done back there. I mean, you're not gonna come out completely unscathed. Is it sore enough that you got to grab aspirin or ibuprofen? No, it's not that sore. It wasn't at all. But I do want to let you know, as far as I was worried about how long it would take for my original pain to come back. And I will say I'm so grateful that I took 2 extra days off to acclimate myself to going back to the world of pain that I came from. I would say once I got home at the 8-hour mark, I was starting to feel my original pain. And 12 hours in, it was pretty much 70% back. The next day I was hurting. All I wanted to do was lay around, and it's just, I don't know how to explain going from a pain level of 8 and then having an opportunity to go to pain levels of 3 and 2 during your trial, and then go all the way back to 8 in 24 hours. So if you're working, I would say give yourself a little time to take a breather, to get used to what you're already used to. But that was the hardest part, is like having those days of relief and then all of a sudden having it taken away. So at this point, I have a planned date of April the 2nd to get the device put in permanently. But unfortunately, I've run into some complications. While I had the trial, my blood pressure was really high, and they were concerned about the levels that my blood pressure went to. And they, applied different medications during the procedure, and they could not control my blood pressure. So I had to address that with my primary care physician. And the other thing is, I also had an issue that very day that I had those leads removed, I had to have lab work. They wanted to do lab work again, and they also wanted me to get an EKG done. So upon doing the lab work, the results were I was anemic. So I went to the primary care physician with that concern as well. And he did the checks, blood work for the things that could cause anemia. And unfortunately for me, it wasn't clear cut. It was not an iron deficiency. It wasn't a B12 deficiency. So since I'm not short on vitamins and I'm not nutrient deficient, he has to find out why I'm anemic. And depending on his findings, if he's not comfortable that I can do this procedure, he's not going to surgically clear me. So it's a chance that I may not be surgically cleared, and that's what happened to me pre-trial. When they did the blood work for the pre-trial, my A1C was out of control. My A1C was you hush, you little bad joker. I'm sorry, my baby wants to talk. Tell me he hears something outside. So my A1C was 11.5, and I had to bring the A1C down. They wouldn't touch me until my A1C was an 8. And with good behavior and proper medicine, I was able to get my A1C down from 11.5 all the way down to 7.1. So now I'm faced with anemia. With the blood pressure, my general care practitioner was able to give me a medication that has really allowed my blood pressure to be a lot better than it was. Normally, my top number would, even with medicine, my top number would be about 135 to 145. But now, American Heart Association has changed their blood pressure standards. So, according to the Heart Association, your top number should be 120, your bottom number should be 80. So now, my numbers are looking a lot better within that range, actually. So at this point, with the new medicine, my top number hasn't gotten any higher than 125. So I'm really happy with the numbers I've been getting, because I always have the problems with the top number. That's why I'm not discussing the bottom number that much, because I normally have to look at the top one. But yeah, so wish me well. I hope that my information about the anemia comes in time, that I can still make my surgery date. But you don't want to rush anything like this. If I'm not cleared for it, oh well, I'll just have to wait. As I've done it before and I can do it again. So just wish me luck. And that's the removal process and what I'm going through. I'll give you an update as to whether I'm going to go ahead and proceed with the given date, or if I am cleared or not cleared. So see you guys later. Thank you for stopping by.